Excited to be joined today by the Honourable Mark Holland, Federal Minister of Health, the Honourable Everett Hindley, Saskatchewan Minister of Health, and the Honourable Tim McLeod, Saskatchewan Minister of Mental Health and Addictions, Seniors, and Rural and Remote Health. I also see a number of my colleagues here today, as well as our many healthcare sector partners. We are pleased to be with you for this important announcement, which will support improved healthcare access and services for everyone in Saskatchewan. I would also like to take a moment to recognize the first of its kind initiative currently serving as our backdrop for today's announcement. The Regina Urgent Care Centre and the staff that will soon operate it will increase points of access to the healthcare system for patients. I expect that we will be back soon to hear more about this facility when construction is completed. Our government continues to invest in multiple initiatives to increase access and provide a better healthcare experience for Saskatchewan patients. Today's announcement is about improving healthcare for patients across the province with support from the federal government. And now I am pleased to invite Minister Mark Holland to make today's announcement.
Merci beaucoup. C'est un grand plaisir d'être ici pour un jour fantastique. Fantastique dans le sens d'une grande augmentation de notre système de santé ici en Saskatchewan, mais aussi il fait tellement beau à l'extérieur et ça c'est remarquable dans un certain sens aussi. You know, it is so exciting to be here. I want to start by extending my deep appreciation to Minister Hindley, Minister McLeod, to Representative Ross as well, for all of their work to get here today. I can say that Everett and I had a lot of good conversations to get to this point, and that the spirit of cooperation that pervaded those conversations and my conversation with Tim, I deeply appreciate. There's a lot of areas that we can disagree in life, but when it comes to health, I think what people expect of us is to find common ground. To find ways of working together, not finding differences, but finding what we have in common. And I want to say with the government of Saskatchewan that we find a great deal in common on healthcare, and that's exemplified by the opportunity to work here today and make these announcements. You know, I had an opportunity just before this announcement to have a conversation with Joanna Peterson of the Canadian Nurses Association. More than 30 years serving as a nurse. Making a decision about, you know, does she continue or does she enjoy her retirement after a lifetime of giving? And let's be straight. To deliver the health care that we need folks like Joanna to make a decision to continue to serve. It's not enough to add new nurses. It's not enough to bring folks in from other parts of the country or accelerate credentials. We have to do the work that we're doing on retaining and as well as recruiting. And that's why I want to thank Dr. Lee Chapman for her extraordinary work. The focus collectively our government is putting on nursing that's exemplified in this agreement is so essential. And I think it captures the spirit of what we saw in our healthcare system across the board in the darkest days of the pandemic. When things were most difficult and most uncertain, healthcare workers weren't looking for differences, they were looking for solutions. They were looking ways to bridge divides and make things better. And we saw extraordinary progress in a short period of time. That's why, as Health Minister, I was so pleased when we had the opportunity to be in Prince Edward Island in Charlottetown to see the incredibly productive conversations we had on health workforce issues, that we had on data. Conversations I know we're going to continue in the coming days, but conversations that were foundational to us being able to make the announcement that we're making here today. So as a government, this will represent 26 different agreements, all of which will be completed by the end of March, representing some $200 billion of investment in our health system over the next 10 years. This is in addition to the work that we're doing in dental care, which is essential not only as a matter of social justice, but as preventative medicine. What we're doing with respect to diabetes drugs and contraceptives, which again are essential for getting upstream and avoiding illness before it happens. And obviously the work that we need to continue to do together as partners in the space of data. Today, we're signing 2 agreements with the province of Saskatchewan that will invest $560 million for better health care right across the province. By working together, specifically in this instance with Minister Hindley and the provinces to reach an agreement on working together, this represents $391 million over 3 years. This funding is going to be extremely important in improving access to family health services through funding for community-based physicians. It's going to be important to build capacity by creating 64 permanent acute and chronic care beds, including 36 in Saskatoon and 28 in Regina. It's going to support healthcare workers and tackle backlogs for the recruitment of up to 400 internationally educated healthcare workers and more clinical placements for the expansion of 550 post-secondary training seats. It's going to expand the delivery of culturally appropriate mental health and addiction services through more treatment spaces, outreach services that connect vulnerable people with shelter and care, and counseling for youth at risk. It's going to ensure that hospitals are more efficient and can see more patients through new technology infrastructure, upgrades, and digital tools. It's an important partnership, and Everett one that I know we'll continue to work together on and build as a starting line, not a finish line. I want to also thank Minister McLeod for the work that we've been able to do together on the Aging with Dignity Agreement, which represents $169.3 million over the next 5 years. You know, as folks get older, it's essential they be able to age at home, that they be able to age in their own community, and that they have hopefully the opportunity to stay at home as long as possible, or be given the opportunity for a safe long-term care facility. After a lifetime of contribution and hard work, it's essential that every senior be able to enjoy a healthy and dignified retirement in their home community. That's why this funding will help expand community health centers and team-based care that ensure seniors live at home longer. It'll increase the number of health professionals in palliative care to allow more care to be provided outside of a hospital setting. It will hire more personal support workers and nurses to deliver better care to individual long-term care residents. It will deliver better health care for seniors right across the province. Look, these agreements and our collective work aren't going to fix things overnight, but the line of progress is clear. We have one of the best healthcare systems in the world, and by focusing with one purpose, avec un esprit de coopération totale partout au pays, c'est possible de pas juste augmenter notre système de santé, mais s'assurer que notre système de santé est le meilleur système de santé au monde. So with that, it's my great pleasure to turn it over to Minister Hindley and the government to talk about the position of the government of Saskatchewan, and to say, Everett, thank you. It's been a great pleasure to work with you to get to today.
Thanks, Minister Holland, for that announcement and for being here in Saskatchewan today. Not your first time. We've had some meetings previously, and I just want to again acknowledge your contributions and partnership in getting to where we're at here today. As Alana mentioned, a number of colleagues here in the crowd today. Of course, elected colleagues, plus other leaders in healthcare. The CEO of the Saskatchewan Health Authority, Andrew Will. I'd also like to recognize Dino Sophocleus, the president of the Hospitals of Regina Foundation, who has committed through the foundation donations and financial support to so many different projects when it comes to healthcare here in the city of Regina, and that includes this one right here, the urgent care center that we stand in front of today. So to Dino and your team, thank you so much for your contributions. We're pleased to be here today to partner with the federal government to benefit Saskatchewan residents and communities through the agreements we are signing today. As Minister Holland mentioned, the Working Together to Improve Healthcare for Canadians agreement, as well as the Aging with Dignity agreement. And thank you as well to our provincial and the Health Canada officials who have worked on finalizing these agreements, along with the detailed action plans for both of these. In total, both agreements will amount to $560 million in new funding to the province of Saskatchewan. The federal funding commitments will help support provincial investments already underway to meet the health and mental health care needs of patients in our growing and changing province. It will also help to build stronger healthcare teams and modernize our healthcare system. Federal funding in Saskatchewan's Working Together agreements over 3 years, beginning in 2023-24, will help accelerate and expand provincial initiatives in several key areas. Expanding access to family health services, including in rural and remote locations, improving access to quality mental health and addiction services, supporting healthcare workers and reducing backlogs, and modernizing our healthcare systems. The future Regina Urgent Care Centre will be a major achievement for our province, and I look forward to the significant impact this service will provide residents in Saskatchewan. The centre, once it opens, which will be in the not-too-distant future, will be open 24 hours a day, 7 days a week, and will add to the existing continuum of care services available to patients. It will function as an alternative to emergency departments for health needs that are not necessarily life-threatening, but still require attention before the next day. And it also has a separate intake for mental health and addictions patients, which is also so critical to the work that we provide and the services we provide to people across Saskatchewan. And we look forward to the Urgent Care Centre here in Regina opening its doors later this summer. Saskatchewan's patient-first approach recognizes the importance of meeting the needs of the individual. It means responding to specific health needs and the challenges of different population groups. And with respect to Indigenous people, our government continues to build and strengthen partnerships with First Nations and Métis communities to provide culturally responsive, inclusive, and safe healthcare services to Indigenous people. And we look forward to seeing continued progress on multiple initiatives we are undertaking to improve the health and well-being of all our Saskatchewan residents. With that, I'd like to turn it over to my colleague, the Minister of Mental Health and Addictions, Seniors and Rural and Remote Health, Tim McLeod.
Thank you very much, Minister Hindley, and thank you, Minister Holland, for joining us this morning. Good morning, everyone, on a beautiful morning here in Regina. It's an honor to join our Federal Health Minister, Mark Holland, and Saskatchewan's Health Minister, Everett Hindley, for today's announcement. These two bilateral agreements include remaining funding from a previous bilateral agreement on home and community care, as well as mental health and addictions. Through the federal funding agreement for mental health and addictions, we are continuing with projects previously supported. For example, enhanced addictions medicine training, community recovery teams, mental health residential supports, and others. We've seen significant actions taken in these areas. The federal government's funding commitment will build upon the provincial investments and help accelerate and expand the initiatives that are already underway. We're also committed to providing quality health services and programs to support our seniors to live safely and comfortably in their homes and communities. Federal funding support in Saskatchewan's Aging with Dignity Agreement will help deliver healthcare services to our seniors as close to home as possible through improved long-term and palliative care and enhanced home and community care. It will support provincial initiatives in such areas as expanding community health centers as physical hubs for interdisciplinary community health teams, supporting long-term care homes in meeting provincial standards and program guidelines for special care homes, and supporting frontline care staff to enhance quality and provision of care, as well as resources targeted to inspection of long-term care homes. We welcome the collaboration with the health system partners as well as the federal government to provide our best care for our residents. Thank you very much. I'll turn it back to Alana.
Thank you, ministers. This concludes the official speaking portion of our event today. Following the official signing, which will take place right away, the ministers will be available for a question and answer period from the media. Thank you very much for attending this important event today.
So we'll now begin the question and answer period of the announcement. If you have a question, please come up to the mic, state your name, your outlet, and who your question is addressed to. A reminder, you have one question and one follow-up. Thanks.
Good morning / afternoon, gentlemen. Musa Imran here with Global News. Question for Mr. Hindley. $500 million in investment sounds fantastic. That's great. But for the average person in Saskatchewan, what does this mean, and how soon can they see changes? Because obviously this sounds cool, but obviously there's a 3-year portion, there's a 5-year portion. Yeah. What, if in the most simple terms, what does this mean, and how can people see a tangible difference in the near future? Sure,
yeah, and great question. And I'd like to begin just again by thanking Minister Holland for his partnership as we've worked on this over a period of weeks and months to get to where we're at here today. You know, as I said in some of my earlier remarks and in the comments I made previously, I think what this does is it helps support a number of initiatives that are, some that are already underway here in Saskatchewan. The Urgent Care Centre behind us here is an example of that. And the funds that we're going to be receiving through these 2 bilateral agreements will be used to support projects like this. So what does that mean to the patient in Saskatchewan that is in need of health care or needs to utilize the healthcare system? Well, I think it's, you know, it's important, right? And it will make a significant impact of, you know, being able to partner with the federal government for these additional dollars. It means being able to do projects like this one here behind us. It means being able to, as the federal minister talked about, modernizing our healthcare system, which is something that we talk about as politicians, and trying to make the system easier for patients to navigate. We want to ensure that it goes towards to capital projects and helping mental health and addictions as an example as well, which is a growing need here, not just in our province, but I would say in provinces and territories right across Canada. So ultimately, what we hope that these dollars are providing to us here today and in the years ahead will support those people. The Aging with Dignity agreement will support senior citizens by providing access to care closer to home. As the federal minister talked about, perhaps that means being able to have more services in their own home, perhaps. So those are just a couple of examples, but I think again it's about making sure that we're shortening wait times for healthcare for patients and creating better access for them.
And if I could just follow up here, wait times, the hospital staffing, these are all things that we've covered and had conversations about over the past year or so about how things are really bad. My question is, are we just investing more money into these things to hope that solves the problem, or are there other safe catches to make sure there's actual change, or was it always just a money problem and now we're investing the right amount of money? I would say that that it's a combination of it. One, we're grateful for the dollars we're receiving from the federal government as a result of these agreements that we're signing here today. Two, and this isn't just specific to Saskatchewan, I don't think, but I would also say that there does need to be change, and there has been change when it comes to what's happening in healthcare to make the system more efficient and frankly more responsive to the patients, because ultimately that's what we're all trying to achieve, is to make sure that the patients, it's a patient-first approach, and that people, when they go to access healthcare, that they do have the ability to access it on a timely basis. So whether it's announcements like today, how that can support things like the Urgent Care Centre, how it can support initiatives such as the expanded use of virtual care, giving people other alternatives, I think, and really looking outside the box to find ways to reinvent what we're doing when it comes to healthcare, taking the best parts of the healthcare system that we currently have and making it better. Learning from other jurisdictions in Canada and frankly outside of our borders as well, I would argue, to make sure that we provide the best possible healthcare we can for Canadians and for Saskatchewan residents. Thank you.
Lisa Schick, 980 CJME. Just, I guess, to be clear, this money is it going to just support what you're already doing, or are there new initiatives coming, and if so, what are the new ones?
Sure. Yeah, thanks, Lisa. So the dollars that we will be receiving, as I indicated a bit in my remarks, some of this dates back a little bit to 23, 24. But I think we have taken a number of steps in recent years to make some significant investments into healthcare. The dollars that we'll be receiving now as a result of these 2 bilateral agreements with the federal government allow us to continue to invest in those initiatives, expand them, and I think also accelerate them as well. We'll be working very closely closely with our partners at the federal government, and there's expectations there from the federal government as to what these dollars would specifically go to, and I think Minister Holland might have a few comments about the partnership in that regard. But we'll work closely between our provincial and federal officials to make sure that it's supporting initiatives that we currently have underway already that can be expanded or expedited, and then also look at the opportunity for new investments or new initiatives as well.
Yeah, I would just add that, the partnership that we have here is so important, not just in these agreements, but really the work that we're going to be doing, and we, we're going to have to talk about when we get together in the next little bit as health ministers in the lead up to the annual meeting that we're going to be having in Halifax, to look at how we collaborate on all levels of the system. So, as a federal health minister, I see my role as sort of a convening role, and to try to help find common ground and find ways that we can work together. And if we're going to take on the challenges that exist in health, we have to be dealing with the health workforce crisis of right now. This agreement does exactly that. We have to be able to make sure that that person who needs care is able to get the care, that they have a relationship with a family doctor, that they can walk into a clinic and they can be seen. Because if they don't get that minor problem becomes a massive problem down the road. We have to make sure that we have culturally sensitive care, that people, when they walk into a facility, feel seen, cared for, that feel that that's an environment that they can open up about their health circumstance. And then we have to tackle data, and I know that Everett and Tim feel passionately about this as well. Data saves lives. So how are we going to work together to make sure that we protect data, to make sure that it doesn't go to the wrong places, but at the same time, make sure that that data flows and that there's interoperability in the system, so that patient records are easily accessible, so that a doctor doesn't have to do something 5 different times or use a fax machine to be able to send information. And in that is also an opportunity to reduce the burden for healthcare workers on administration, to make sure that they're spending more time caring for patients and less time doing redundant or unnecessary paperwork. So how our systems communicate with each other, making sure that we're addressing wait times, helping people age in place, making sure we have stronger aspects in prevention, making sure that folks have a relationship with a family health doctor, and then, frankly, I could talk about what we're doing in dental and pharmacare, and how this is part of a 360-degree approach to tackling the challenges that we have in health. You can't just pick one area of health. You have to come at it from every single direction. That's daunting. But I think the challenge should be, can we demonstrate progress every single day in every aspect of our health system, and is squarely in our hearts, in the intention of everything we do, making things better, not finding differences, not finding ways to disagree, finding solutions, finding ways to work together. And I think that's what you're seeing here today.
And both of you have touched on this, but Minister Hindley, I wanted to ask specifically, a lot of this is going to depend on having those bodies, having those healthcare workers, which is a problem. I know there has been some progress, but not nearly as much or as quickly as people who need healthcare are looking for. So how is this money going to fix that?
Yeah, and some of this funding, to be clear, goes towards stabilizing workforce types of initiatives and to recruitment and retention of staff. We need to make sure that for facilities like this that we do have, such as the urgent care center, that we do have the appropriate staff to operate and provide the health care that is necessary in these facilities. We've made, I think, as a provincial government, some fairly significant strides when it comes to health human resources and our action plan that was launched a year and a half ago. That builds upon previous initiatives and incentive programs. The establishment of the Saskatchewan Health Recruitment Agency, working with our partners in the healthcare system to make sure that we are recruiting people and more staff to a growing healthcare system, as we have a growing province, growing population, and growing demands on the healthcare system, and making sure that we bring in more staff, and that we are doing as much as we can to retain the staff that we presently have working in our healthcare facilities. So significant work has been happening. We've seen some positive announcements when it comes to a number of different healthcare providers that have been hired and recruited and brought into this province, and that work is going to continue, and I'm hopeful that the announcement here today will help us to continue to do that good work when it comes to making sure we have the staff that we need.
Thank you.
Musa Imran with Global News. Just a follow-up for the federal minister. pardon the callousness of this question, sir, but is Saskatchewan in such bad condition that it needs $500 million to bail itself out, or is it an opportunity for investment that you see here, or is it a little bit of column A and B?
Well, let's start by acknowledging the extraordinary healthcare system that we have. You know, I get the privilege of talking every day to talk to cancer patients who got to have their lives saved and not pay a dime, where in any other jurisdiction it would bankrupt their families and they'd have to sell their homes. I see extraordinary doctors, nurses, nurse practitioners, personal support care workers who are the best in the world, providing the highest quality of care. So this is about, the world is heavy right now. You know, the pandemic was a brutal thing for healthcare workers to go through. Every health system in the world is stressed. There was a recent report that Canada had the second best healthcare system in the world, but that doesn't feel good enough. And that's what this is about. We can see a line to the potential of a healthcare system where everybody gets the care that they need. And that's at the heart not only of social justice. You know, my son was in a terrible car accident last week. I was scared for his life. He got some of the best care of the world. He was taken to Sunnybrook. And you know, it wouldn't have mattered whether or not he's the son of a health minister or the son of somebody who just moved here and had no money. He would have got that person would have got the same care. That matters. That's the kind of country we want to have. And when we make those investments in health, when we do what we're doing here today, when we get rid of the backlogs, when we get people access to the medicine that they need, when we take care of prevention, then people are healthy. If people are healthy, it costs our system less money. People are more productive. You can't focus on building your business or doing your job if you're worried about whether or not you've got good oral health care or any oral health care at all. You know, how are you supposed to go out and do your job if you don't have diabetes medication? So, you know, this stuff is fundamental. I think fundamental is a question of social justice, but it's also at the core of productivity. And if we make the right investments, and I know that this is something that we completely agree on, if we reduce costs by reducing illness, by attacking the things that really make us ill in the first place, then we have an extraordinary society. Now, we have to be clear-eyed. I'm not saying that we don't have challenges in our system. We do. But, you know, I think back to a nurse that when I was in PEI at the very beginning of this journey, who was carrying the weight of the world on her shoulders in a remote community. And she said, I just need to see a light at the end of the tunnel. I need to see things are getting better. And I think that's what we're seeing. And I think what people expect of us is that every day we have a new way that we're tackling this problem and making it better. So we have a good system, but we can see the potential of it being extraordinary, head and shoulders above any other health system in the world. And that's our North Star.
Thank you.
Sorry. My question is for Mr. Holland. I've heard that you have a great French speaking, so will it be possible to say the big lines of the today's announcement and maybe why this is important for the province?
Absolument. Je suis pas certain que ça c'est le cas avec la qualité de mon français, mais je peux expliquer les raisons pour lesquelles nous sommes ici aujourd'hui. Pour une annonce, une attente tellement importante pour le Saskatchewan, mais aussi pour le Canada généralement. Je pense que les personnes partout au pays veulent la coopération, un vrai esprit de coopération, de trouver pas le chicane. Ça c'est absolument facile de trouver les chicanes, les problèmes. Ça pas demande les travail ou l'intelligence, pas de tout. Mais c'est tellement difficile de trouver les solutions. Et pour moi, mais c'est pour les années de s'assurer que le soin de santé est là, le soin pour le boucan dentaire ou les médicaments est là pour les personnes. C'est pour moi, ça c'est essentiel et ça c'est dans mon cœur absolument chaque jour. Mais ici, avec le temps aujourd'hui, il y a des actions concrètes avec les situations actuelles parce que vraiment, il y a une crise. On manque le nombre de personnes suffisant pour notre système de santé, le médecin, l'infirmière, les choses comme ça. Mais c'est possible avec beaucoup d'actions. L'action aujourd'hui, mais aussi autour de ça, l'action de réduire le temps et de réduire l'administration, d'augmenter les solutions-là, et aussi de prendre l'action pour aider les personnes âgées chez eux. Et aussi d'augmenter la qualité de soins dans les long-term care facilities. Alors, l'action aujourd'hui, c'est tellement important. C'est pas la solution en total. On doit continuer chaque jour de travailler tellement fort, et ça c'est clair dans l'esprit de notre conversation aujourd'hui, que pour Everett et Tim et toutes les autres, on va continuer notre effort.
Thank you.
So I'll now go to the questions on Zoom. Marie-Pierre, over to you.
Merci beaucoup. As we mentioned, we will now proceed with questions.
Thanks so much. That concludes today's announcement. Thanks, everyone.